For the shoulder examination, we're going to be looking at the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint. At all of these joints, we're going to be looking for any swelling or redness. For the glenohumeral joint, we're going to compare it with the other side because whenever it swells, it's going to swell anteriorly. Also, whenever we're looking at the deltoid, we're going to be looking for any atrophy, and instead of having this round curvature, it's going to be a square curvature. It's really important to look at the malalignment of the shoulders as well as comparing both of the sides. Also, whenever we're looking for any muscle atrophy, we're going to look at the supraspinatus, the infraspinatus, and the teres minor. Also, we're going to be looking for any winging of the scapula. The second part of the shoulder examination is to feel. We'll begin at the medial aspect and work our way to the lateral aspect. We're going to begin by palpating the sternum towards the sternoclavicular joint. We'll palpate here for any tenderness. We'll follow the clavicle, the medial convex area towards the lateral concave area of the clavicle. And this is going to meet with the acromioclavicular joint. We will palpate the acromioclavicular joint for any tenderness. On the lateral aspect of the clavicle, we will find the coracoid process and check here for tenderness. Going back up to the acromion, we'll work our way to the lateral aspect. Below the acromion, you have a subacromion bursa, best palpated when the shoulder is extended because the bursa is moved anteriorly. Posterior to that, you will find the subdeltoid bursa. Back on the acromion towards the humerus of the shoulder, when it's externally rotated, you will be able to feel the bicipital tendon, which is located in the bicipital groove. We will then palpate down the humerus and onto the spine of the scapula. While doing this, we're checking for any tenderness or redness. At this time, we're also going to check the muscles, the supraspinatus, the infraspinatus, and teres minor. Along with the upper part of the trapezius. When conducting the shoulder examination, it's important to not forget to check the axilla. We'll check the medial portion, the lateral portion, and then behind the pectoral muscles for the lymph nodes, and the posterior aspect for the lymph nodes. We will conduct a formal active range of motion test where we are looking for the smoothness and the extent of the movement. Can you abduct your arms to the sky for me? Now can you bring your arms behind your head and push your elbows back? Can you bring your arms back above your head and turn your palms outward? Now will you drop your arms down by your side slowly? With your left arm, can you touch your right shoulder? Now relax. With your right arm, can you touch your left shoulder? Now relax. Will you face sideways, please? Can you place both of your arms above your head in front of you? And now bring them down behind you. And relax. Now will you face the back wall? Well, you reach back behind your back with your right hand as if you were scratching your back as high as you can. Now can you do this with your left arm? Okay, now can you do a push-up on the wall? And at this time, we are looking for any winging of the scapula. If there is a problem, then there's going to be a problem with the lateral scapulothoracic nerve. Now can you face me, please? Now we're going to check internal and external rotation. Can you place both of your elbows at a 90-degree angle and then bring them outwards and then inwards towards your body as if you're giving yourself a hug? Next, we're going to go through 3 different tests to check for impingement. The first test, we're going to hold the acromion down and abduct the patient's arm. Do you feel any pain, Mr. Castillo?
No.
Okay, relax. Now the second test is the nearest test. We're going to flex your arm all the way up and then internally rotate it. Do you feel any pain, Mr. Castillo?
No.
Okay, relax. The last test is the Hawkins test. Where you flex your arm to 90 degrees and bend your elbow, adduct, and internally rotate. Do you feel any pain, Mr. Castillo?
No.
Okay, relax. Next, we're going to do a few formal tests to check the rotator cuff muscles. Can I get you to bend your elbows at 90 degrees? And we're going to abduct your elbows to 15 degrees. Okay? Now hold there and don't let me move you. Relax. Now we're going to do the empty can test. Can I get you to bring your arms straight out in front of you? Can you grab that? Alright, and we're going to dump it over like you're dumping out a can. Okay. Now hold there and don't let me move you. Relax. Now can I get you to bring your elbows tucked in at your side at 90 degrees and bring your hands outwards? Alright, now hold there and don't let me move you. Relax. Okay, now the next one's going to be similar, but you're going to pretend like you're hugging yourself. And I'm going to try to pull you outwards, but don't let me. Hold there and don't let me move you. Relax. The last one, you can face the back wall, and you're going to reach with your right arm behind your back, and don't touch your skin. Now I'm going to try to push you towards your body, but don't let me move you. Relax. The next test is the Yergus's test. Can you bend your elbows to 90 degrees and put your palm facing the ceiling? Now I'm going to try to turn your hand facing the other way, and you resist. Do you feel any pain?
No, no pain.
Okay, relax. The next one, can you put your arms all the way out in front of you and your palms facing up? Now I'm going to push down, and don't let me move you. Do you feel any pain?
No pain.
Okay, relax. Now we're going to do another test to check your acromioclavicular joint. If I could get you to reach across your chest to the other side of your body, then I'm going to add some pressure. And let me know if it hurts.
No pain.
Okay, relax. Can you reach with your right arm behind your back? I'm going to add some more pressure. Do you feel any pain?
No pain.
Relax. Okay, Mr. Castillo, now we're going to go through a few glenohumeral joint stability tests. Can you turn around that way, please? I'm going to check your anterior stability, your posterior stability, and your inferior stability. Okay, relax. Now we're going to do the apprehension test. Can you bring your arm out and then flex your elbow, and we're going to externally rotate. Relax. Now we're going to do a quick check of your myotones. If you could hold this position for me. Now hold there and don't let me move you. Relax. Okay, now I want you to follow these movements. If you could do this. Okay, and now this. Okay, and wave, come here. Then stop. Okay, relax. Now we're going to check your dermatomes. C5 is found on the lateral aspect of your arm. C6 is found at the tip of your thumb. C7 is found at your long finger. And C8 is found at your pinky, while T1 is found on the medial aspect of the arm.